You've decided to set up a concussion care practice and you know you can't do it alone, but you don't know exactly who to include in your care team. Let's talk about the disciplines commonly involved in concussion care and how you can access them. When you're creating your concussion care medical practice, it's important to keep in mind the scopes of practice each discipline covers to make sure that there are no gaps in your team. First, the point person. This is a qualified healthcare provider who will be the team lead and will make return to activity decisions. Next up, the athletic trainer. Athletic trainers receive specific education in recognizing concussion signs and symptoms at the point of injury. They also serve as an important liaison between the patient, their family, the rest of the concussion care team, and school or work. You would also include a physical therapist. Physical therapists are involved in vestibular rehabilitation, active rehabilitation, and they actively target a patient's individual needs after a concussion. They know that each concussion is different and every patient needs something specific to them to help them get better. And I want to comment on physiotherapists working outside of the United States. Their scopes of practice depend on country laws, but they might be involved in concussion assessment, concussion treatment, or concussion rehabilitation, or all three. Next up, occupational therapists. OTs are involved in restoring function or getting patients back to activities of daily living after a concussion. Patients that need help performing daily tasks or driving or getting back to school would benefit from an occupational therapist. You might include an optometrist, so if a patient is experiencing severe vision issues after a concussion, they would certainly benefit from having some optometric vision therapy. If you work with students, you would definitely want to include the school nurse on your concussion care team. School nurses are integral for concussion care at the school level. They're involved in ensuring the appropriate academic workload, making sure that academic adjustments are implemented properly, and facilitating cognitive rest during the day. And then finally, we've got speech-language pathologists or school psychologists or other members of the multidisciplinary team. There are so many disciplines that can be involved in concussion care, so it's up to you to decide what you have the resources for and who you need on your team. These additional care team members might participate in returning students to school or working with anxiety and mood issues or any other areas as needed. And if you're looking for concussion care providers to join your team, you can check out concussioncareproviders.com, where you'll find impact-trained occupational therapists, physical therapists, and credentialed impact consultants.